My name is Dr. Neil Baum. I'm a urologist in New Orleans, Louisiana, and I would like to take this opportunity to talk with you about the problem of urinary incontinence in men. In this 7-minute video, I will discuss the causes of urinary incontinence, how the diagnosis is made, and what treatment options are available for urinary incontinence in men. So what is urinary incontinence in men? It's the accidental release of urine. It is not a disease, but it is a symptom of a problem that in most men can be cured and nearly all men can be controlled. So why does urinary incontinence happen in men? It usually happens because the bladder squeezes at an inappropriate or the wrong time. The muscles around the tube that goes from the bladder to the outside of the body through the urethra are damaged or are weakened. Also, it can be due to a problem of a weak bladder muscle that doesn't empty the bladder, or it can be due to an obstruction or blockage of the urethra. Point I want to make is it is not a normal part of the aging process. Now, there are 4 types of urinary incontinence. The first is referred to as stress incontinence. When a man coughs, sneezes, bends over, exercises, or increases the pressure in the abdomen, it is transmitted to the bladder and causes loss of small volumes of urine. Urge incontinence is that condition when a man can't make it to the restroom or toilet in a timely fashion. Overflow incontinence is the condition where the bladder doesn't empty because the muscles are weak or the urethra, that tube that I just mentioned that goes from the bladder through the penis to the outside of the body, is blocked. And total incontinence is that condition where a man is always leaking urine. Now, the causes of urinary incontinence can be due to prostate surgery, where it is usually temporary and will resolve in a few weeks or a few months. If a man has a urinary tract infection, this too will also resolve with antibiotic treatment. Prostatitis, or inflammation of the prostate gland, can be cause of incontinence that also goes away with treatment. Constipation is another common condition, especially in the elderly, that is associated with the problem of incontinence, but when the constipation is relieved, the incontinence will become significantly improved. Also, a man who has incontinence may have more than one cause of his problem of urinary incontinence. Let's now look at the evaluation. The evaluation is easily conducted with a careful history, a physical examination, an examination of the urine or urinalysis, and a few simple tests that can be performed in the doctor's office. Those tests consist of possibly a urine culture if the urinalysis is abnormal. Also, a man will be asked to void over a machine called a urofluorimeter that will measure the volume of urine and the time that it takes to empty the bladder. A bladder ultrasound examination is a non-invasive test that is used to determine if there is any urine left inside the bladder after the man attempts to urinate. Sometimes a man will need a procedure called a cystoscopy, which is the insertion of a lighted tube through the urethra to examine the urethra, the prostate gland, and the bladder. And only occasionally, if there's a suggestion of nerve damage, is it necessary to do a urodynamic study, which measures the pressure in the bladder and the flow rate when the man is attempting to urinate. Now let's look at some of the treatment options, beginning with very simple home remedies. There are a number of bladder irritants, such as coffee and tea that contain caffeine, that if they are reduced will help control the problem of urinary incontinence. Also, it is noted that large quantities of alcohol can relax the muscles associated with keeping the urine inside the bladder, so we recommend no more than 1 alcoholic drink per day. Also, it is important to avoid smoking, because smoking leads to coughing, and coughing can lead to the problem of stress incontinence. For those who are overweight, a weight reduction program will also help improve the problem of urinary incontinence. Also, you can use a timer and to set your alarm to go to the bathroom at designated times during the day to prevent your bladder from getting too full, and that will help alleviate or control urinary incontinence. If you have the problem of urge incontinence and can't get to the restroom in a timely fashion, you probably want to wear clothes that can be removed quickly, so when you have to go to the restroom, you can easily get to the restroom and then start to urinate without having to worry about your clothing. Also, another home remedy or simple conservative method of management is the process called double voiding. And that is where you go to the restroom, relax for a few seconds or a minute, and then attempt to go again. Finally, let's look at the treatment options available for urinary incontinence in men. Sometimes there are strategies such as decreasing the amount of fluids that you would consume before you go out to a restaurant, a movie, or a social event. Exercise, general exercise such as walking, keeps the muscles in tone. There are exercises that you can do on the muscles around the urethra called Kegel exercises that your doctor can show you that will strengthen the muscles that are responsible for helping you control urination. Oftentimes a man may have to resort to continence products such as pads and diapers. There are medications such as antispasmodic medications, antibiotics for treating infections, and also avoiding medicines that can cause incontinence, such as cold and allergy preparations that are available over the counter. In some men who are having difficulty emptying the bladder because of a weakened muscle, they can catheterize themselves by inserting a tube through the urethra into the bladder multiple times a day to empty the contents within the bladder. And finally, if these conservative methods don't work, there are surgical options that are available for controlling urinary incontinence in men. In summary, urinary incontinence in men is a common condition, usually occurs in middle age and older men. The evaluation is very easy to perform. It can be done in the doctor's office in an outpatient setting. At that time, a few tests are needed to diagnose the problem. And finally, most important of all, nearly all men with the problem of urinary incontinence can be helped, and most can be cured of this problem. I hope you have found this video information useful. If you have any additional questions, please do not hesitate to give me a call at 504-891-8454, or you can reach me through my website at www.neilbaum.com. Thank you.